Hey y'all, I just wanted to make this real quick video. Hopefully it's not going to be too long, but I did wanted to kind of clarify exactly what type of breast cancer I was diagnosed with. I don't know if I was being clear enough in my last video, but I was diagnosed with invasive ductal carcinoma and also ductal carcinoma in situ, which is it DCIS, something like that. And it was stage 1 before the surgery, and then after the surgery it became stage 1B. And I guess it's because of the size of the lump was a little bit bigger by the time I had the surgery. So a little bit about that. I found my lump myself, and just from coming out of the shower and doing your normal lotion whatever routine, and I felt it, and I was like, what is that? I never felt that before. But within like a week or two, I had made an appointment to see my doctor about it. At that time, and this was probably like November of 2020. So this was last November. And at that time, when my doctor checked it out, it was pretty small, and it was movable. It was movable. So she wasn't too concerned. She was saying, that I'm not too concerned because it's pretty movable. So just do like some warm showers, warm compressions, and see if anything changes. So I did that for like a month or so, but it didn't change. It actually became more noticeable. So I don't know if it was actually getting bigger or whatever, but so it didn't change. So I contacted her again, and she was like, well, if you're so concerned about it, I'll just refer you to get a mammogram. And so I was like, okay. But in the back of my mind, I'm like, I'm too young for a mammogram, but okay. So I got the mammogram, which was like almost like 3 to 4 weeks later. I was able to get an appointment for a mammogram. So I got the mammogram, and they saw the lump right away. But what they were trying to do was to smash it. I think that they were trying to see if it was filled with fluid or not, but they just had the machine turning me all kinds of ways, and they already pressing really hard, so they were trying to smash it to see if it was filled with fluid. And he also was taking pictures of the other breast too as well. So, but anyways, after the first mammogram, they were like, well, we think we see something on your other breast, so we want you to come back and do another mammogram so we can take a deeper look, or another look from another angle, or whatever the case may be. So I was like, okay. So I had to have a second mammogram, which was maybe like 3.5 weeks later. At this time, my appointments were scheduled out maybe like 3 or 4 weeks, and it's only because due to the COVID rules at that time, they didn't want too many patients in the office at the same time. They were trying to schedule out appointments, as far apart as they could. But so a lot of time is passing within these appointments, and I know some people who've been sharing their journey, things for them was happening pretty quick. But for me, it just seemed like it was just so spread it out, you know. But so the second mammogram, they told me, well, we thought we saw something on the right breast, but we didn't see anything on the right breast. I mean, like it was normal, whatever, so that wasn't a concern. But they did want to take additional pictures for the left side, because that's where the lump was, on the left side. And where my lump was, like, I could feel it. I didn't have to raise my arm or anything. It was like I can feel it right there. It's right on. To me, it felt like it was right on the surface, because I can feel it, But so the second mammogram, and they took more pictures and more pictures and more pictures, and then they were like, well, we're gonna send these to the doctor, because at that time the doctor was doing virtual appointments or something. So they were taking the pictures and sending it to the doctor. She will email back or do, it's like a back and forth thing. So she's like, well, we're gonna send these to the doctor and we'll be right back. So she comes back and she says, well, the doctor wants you to get a biopsy. And I was like, a biopsy? I mean, not a biopsy, I'm sorry. A sonogram. I want you to get a sonogram. And I was like, a sonogram, And when I hear a sonogram, I think, pregnant people. I'm like, a sonogram? Never heard of sonogram on your breast, but okay. So, and this was another additional maybe 2 or 3 weeks, So, I had to come back to get a sonogram, a breast sonogram. So I came back, I did the breast sonogram, and it was almost the same like they would do if you were pregnant. They put the like little warm gel stuff, and they used the little wand thing, I don't know, and they kind of went all over the breast. They even went up under the arm. They even went as high as my collarbone, and I was like, what are they doing? The lump is right here. Why is they going all over the place? At this point, I still didn't know what was going on. They wasn't really telling me anything. They were just basically suggesting me to get this done, do another mammogram, sonogram. They wasn't really explaining anything. But so after the sonogram, she went back and said, I'm gonna speak with the doctor. I'll be right back. So she goes to the room, and maybe like 20 minutes went by. Like, it was a long time. And she comes back, and she has the phone in her hand, and the phone was the doctor on speaker, and she was like, well, the doctor wants to speak with you. So at that moment, like, my heart dropped, because I was like, oh, well, this can't be good, And so the doctor was telling me, that she was taking a good look at all the pictures and sonograms and the mammograms and everything, and she was telling me that she wanted me to get a biopsy. And I was like, okay. And she said, in order for us to be sure exactly what's going on, I recommend you to get a biopsy. And I was like, oh, okay. At that point, I was like, another test. And I'm like, oh, okay. And she heard that in my voice, like, oh, okay. But she said, I know it's a lot, but I'm going to be honest with you, it does kind of look like cancer to me. But in order to be sure, I want you to get a biopsy done. And she said, I want you to try to get it done as soon as possible. So I was like, okay. Like, okay, this is, it needs to be done. So maybe like, another 2 or 3 weeks, because I had to find another facility to do the biopsy. Like, they wasn't really sending me to people. I had to find a facility. So once I found one, because they didn't do biopsies there, so I had to find a place to do them. So they did the biopsy. I found a place. They did the biopsy, which they take this long needle. I mean, it's huge. It's huge, and they take this long needle and they stick it all the way in your breast to where the lump is, and take some snippets, like they take some pieces out and take it to, get the samples to be tested. Which it didn't hurt because they numb you, but I could actually feel the needle go in. I could feel the needle like snipping off pieces of the lump. So that part was kind of, I could feel that, So they explained to me that it could take anywhere from 3 to 5 days for the results to come back. But as soon as the results come back, I should hear something from my doctor's office. I said, okay. All right. But 2 days later, the area where they did the biopsy started to have these like little fluid bumps appear. So I was freaking out. I was like, well, what is that? So I called my doctor. I was like, there's some fluid filled bumps, and I didn't know what it was. I was like, maybe some fluid from the lump was squirting out or leaking. I don't know what to think. So, but the doctor was like, well, you're just having an allergic reaction to the steri strips. That's what that is. Just take the steri strips off, and hopefully it'll go away within a couple of days. And it did. So so that was my first way of finding out that I was allergic to steri strips. So I can't have steri strips. But it took maybe like 3 days for them to call me back and for the doctor to tell me the results of the biopsy. And so that's how I found out, that I have breast cancer, and that it was stage 1, and that she recommended me to get surgery right away before it started to spread anywhere else, because on the sonogram it showed that my lymph nodes were normal. The area near my collarbone and the tissue around it was normal, even though it was invasive. It was just coming out of the milk ducts. It wasn't like, it hasn't had a chance to like spread, but it was out of the milk duct, which is what made it invasive, because it was out and invading the area around it, But I also had the ductal carcinoma in situ, which means in some areas in the lower part of the breast there were some specks that they found that were still inside of the milk ducts. So at that point, she told me, I would recommend you to have surgery right away, and to find an oncologist that will take your insurance. So that took me a while. It took me almost a month to find an oncologist that accepts my insurance, because I would call doctors, but they wouldn't accept it. They'll say, well, the hospital does, but the doctor doesn't. Or the doctor does, but the hospital doesn't. I mean, it was just so crazy, you know. But it took me a while to find the doctor that I found, and which I'm so grateful for because she's wonderful. But so when she found out everything, she took a look at, you know, all of my tests and everything. And initially, the plan, we went ahead and, you know, started a treatment plan. When I started, but planned a treatment plan right away. And we decided to just do a lumpectomy. But she was like, but before we do surgery or anything, I want you to have a breast MRI. So I was like, okay, yeah, that's cool. So we do a breast MRI, and it showed the institute, the DCIS at the bottom, and also showed the lump. So she was like, well, you know, initially we're talking about just removing the lump, but since there are other things in other areas that we see, I recommend you to just remove the whole breast tissue. So at that point I was fine with it. I was like, okay, we can do that. Just remove the whole breast tissue. But then I called her back and I was like, well, if we're removing all of the left breast tissue, could I just go ahead and get the right tissue removed too as well? She told me that a lot of patients do recommend, I mean, not recommend, but they do that, you know, even though the other breast is totally healthy, that they often will have them both removed. So, I knew that's what I wanted to do. I knew I wanted to have both removed, and that's just for my own insanity. You know what I'm saying? I wouldn't want to just get one removed, and even though this one, the right one, was totally healthy, totally fine, I wouldn't want. It's just in the back of my head, you know. It's like I wouldn't want anything to happen with the other breast, so just have them both removed, and I won't have to worry about that. So they did. I had a double mastectomy, which is, you know, a bilateral mastectomy, which they remove the breast tissue from the cancer breast and the breast tissue from the healthy non-cancer breast. So, so I had the double mastectomy with immediate, what do you call these, expanders? With immediate expanders placed. So I actually left the hospital with maybe like a size A breast. They were pretty big because I wasn't expecting to have anything. I was thinking it was going to be flat because they told me, the plastic surgeon told me that every 2 weeks I would have them filled to stretch the skin to, you know, get them to the size that I would want, because I knew right away when I met with my plastic surgeon that I did not want implants. I knew I did not want implants. So he was explaining to me the option of the DIEP surgery, the DIEP surgery, which is they take tissue, not muscle, you know, not even fat, I don't think, but tissue from your stomach area, and they put it in your breast, connected with the blood vessels, so it can stay alive. That's basically, so it can stay alive and the blood can flow through, and that would be my breast, and which would be the natural route, you know. And I knew I wanted to do whatever I could that would be the natural route. And if I wasn't able to do the DIEP surgery, then I would just probably been flat for however long until I was able to get the procedure done. But he said that I would be a good candidate for it, so we chose this route for my surgery. So now I have these I call them balloon bricks because they are hard. They are hard like bricks, but they're like balloons because when they fill them up, of course they expand. But so I didn't want to make this video too long, but I don't want to seem like I was rushing any information, but I did wanted to make sure that I was clear on what type of breast cancer I had, just in case people were confused. But it was invasive ductal carcinoma and in situ stage 1B, and no lymph nodes involvement. Those were totally clear. So yeah, with a double mastectomy is what I have. But tomorrow I have a consultation with my plastic surgeon regarding to my reconstructive surgery that I'm having in like less than 2 weeks. Less than 2 weeks. I'm not too nervous about it, really, but it's, what's really crazy is that I'm not used to just depending on someone to help me. I'm always the person who's helping other people, and to have the roles reversed is kind of hard for me because I'm like, well, I know I'm gonna need somebody to care for me, but it's gonna be hard, because I'd rather do it myself. What?
How old is Kai?
I don't know, 6 weeks.
Huh?
I don't know, 6 weeks or something. Go. I'm doing a video. Kids. But yeah, so we'll see how that goes. It's creeping up on me. It'll be here before you know it. So, yeah. Oh, and another thing that I learned about not my surgery, my breast cancer, it's hormonal receptive, which means it's estrogen and progesterone positive. It's HER2 negative. The HER2, that's like another video. I'll have to talk about the HER2 scare that I had, but it's HER2 negative. Um, when I had the genetic testing, it's not genetic, so it came back, not genetic type of breast cancer. What else? Yeah, that's it. But maybe like 3 months ago, I started the Tomoxifen. So I'm gonna do another video about the Tomoxifen because we got to talk about this Tomoxifen. We have to talk about this Tomoxifen to all of my pink sisters out there who has the hormonal receptive positive breast cancer that have to take this Tomoxifen. I can't even talk. Tomoxifen. Yeah, that's gonna have to be another video because this Tomoxifen is something else. It's not too bad, Don't get me wrong, it's not too bad, but it's like it drains the energy out of me. I don't know what it is, but anyways, that's another video. So hopefully, I don't know if the plastic surgeon will be okay with me bringing y'all to my appointment tomorrow, but we will see. We will definitely see. If not, I'm definitely gonna make another video tomorrow just to kind of keep y'all up to date with the information that they're going to tell me about my reconstructive surgery, because that one is coming really soon. And I know it's a lot of my pink sisters out there who are kind of choosing maybe to go this route that may have some questions or something, so that could actually be beneficial to them, to let them know, exactly what my plastic surgeon says, just to kind of give some insight. But okay, well, I'm gonna end this video, and hopefully they'll let me record tomorrow. And if you have any questions, drop them below, because I do want to do a Q&A video, but I know there's other questions out there too, so I mean, don't be afraid to ask me any question, so I can try to answer it and help anybody that I can. Because again, this even though this is my journey, but I'm documenting it to try to help other people. So all right, y'all have a good night. Shalom.